So, good evening, everyone. It's my pleasure to be here with all of you. And I am Mahmoud. I am a clinical psychologist from our project. And will be with me our clinical director, Dr. Amira, inshallah. So, our project started after 2006, after Iraqi wars, then expanded with the Iraqis, then for the Yemenis, Syrians, and Palestinians, Somalis, and Sudanese also. So this from 2026 until 2025, these kind of statistics that we have numbers here, but the pediatric cases was this number, it's around 20% of our patients, they are a pediatric case. We are provide, me as a mental health and the mental health team in the RSH, we are providing a psychological support for our patients and their caretaker also. It's tailored for both of them. It's a journey. It's a stages they had being through the reconstructive surgeries. So the psychosocial dimensions of pediatrics, especially for the pain, there is an overlapping in the contraindications between the pain and psychological conditions also always affecting for each other the perception and the expressing of pain. It's also, we face it as a patient, the patient faces it during the journey of treatment. So here we have a quote from one of our patients. His name is Ahmed, Yemeni male. He's 16 years old, by the way, who were receiving treatment at our hospital since he was 6 years old. This quotation from him, he shared that my childhood memories are full of pain, operations, and hospitals. Imagine how this kind of journeys affecting on his psychologically. So these kind of indications related to the pain and how the pain and the psychological conditions affecting each others. As we saw here, the anxiety, it's more common with the patients who are suffering from the pain, the depression, and behavioral problems that they had affected by the pain or the opposite. So he's one of our heroes. We said Hussein, he's one of our heroes. So today we will introduce it from the beginning. Surgically, medically, Dr. Amira, she will present it. Dr. Amira.
Good evening. So I'm here to talk about the story of Hussein. Hussein is one of our patients who are here coming to Amman, to our project. He's one of the pediatric cases. So many cases, they have the same history. He's a 12 years old from Yemen, exposed to 4 gunshots, posterior aspect of his leg, when he was 7 years old, resulting in a big wound on the posterior aspect of his leg and fractures. So Hussein, he had many surgeries back in Yemen, and he was referred to our hospital in 2022. He had multiple admissions, 3 admissions from 2022 to 2025. Hussein, he presented to us with big bone gaps and soft tissue defect, walking difficulties, pain, anxiety, malnutrition, isolation, self-esteem, negative body image, and poor coping skills. When he was admitted to our hospital in 2022, he had many surgeries, and we treated him for infection because he also had he had infection, bone infection, osteomyelitis. At one point, he had a skin rash, and we thought that it's related to the antibiotic, but then when we took skin biopsy, it turned out to be Langerhans disease. On top of all the injuries that he had, and the fracture, the infection, also it turned out to have Langerhans disease. So the father, he was a big obstacle because the father, he couldn't believe that this skin rash was related to the disease, but it's related to the surgery, to the antibiotic. After many surgeries he had, Then in 2025, we decided the prognosis was not very good, the bone quality was not good, also the tissue was not very good. So we decided to do above knee amputation. So in 2025, Hussein came for above knee amputation. When he came, we had difficulties with the father. The father, he couldn't sign the consent. He asked me personally, because I had so many sessions with him, also with other orthopedic surgeon, like we had first opinion, second opinion, third opinion with orthopedic advisor. We sit with him, he's not accepting. And he was saying, he told us, like, can we do this surgery when he's 18 years old so he can sign on himself? Because he couldn't take the responsibility for the amputation. Although the boy, he agreed about the amputation. And he's like, my only thing is like, I don't want the amputation to be above knee, but if it's possible to do it below knee. So then with the surgeons, again, we met and we discussed and we said, yes, we can do it below knee. Then with the father, it was very difficult. So then we had to ask from the mental health support. So he had many sessions with the mental health team, specifically with Mahmoud, actually. After a few sessions, the father, he signed a consent, and he was okay with that. Hussein, after the surgery, he had some pain, physiotherapy for prosthesis, also for pain, and with mental health, he had a bit of pain management. After that, Hussein, I will leave it with Mahmoud because he left with the prosthesis and left like walking. He gained weight. He started to interact with other children in the hospital. It was very difficult because Hussein, he had like maybe between 11 to 13 surgeries since the time of the injury, 2021. So he was exposed to many surgeries, a lot of pain, a lot of stigma, a lot of like self-image, negative image about himself, like he was not interacting with other children when he was in the hospital. Yeah. And then I will leave it for Mahmoud to talk more about the psychological psychotherapy.
Thank you, Dr. Amira. So, for us, from psychological point of view, it's an interested the emotions, the feelings, the father, the caretaker itself that he had, the mother even she was in Yemen, so we trying to contacted her remotely. So it's very hard for the parents to taking these kind of decisions. So we move on after that. So, but I want just to mention that, as Dr. Amira mentioned, that the psychological preparation, the psychological service for both, for the child and for the caretaker, is starting from the beginning. About the pain, it was consistent with Hussein since the cause of injury, since the injury was happened. So our approach as a pain, it's a multidisciplinary coordination between the teams, the medical, the pain team, nursing, nutrition, the physiotherapy. They had a big part to help our patients with pain. Our objective, the preparation between pre and after the amputation was done, enhance understanding and prepare the child and the family emotionally and psychologically, even also mentally. So these kind of interventions, it's an pre and post for the caretaker and for the patient itself. So I just wanted to highlight for this kind of interventions and a psychological intervention, it's a peer modeling. It's a peer modeling that the child and the caretaker and peer under supervision of peer counseling, introducing the child for a child who had been like these kind of surgeries, and also the father discussing the obstacles, what they're gonna to do, what's the expected, so, and provide them with the realistic reassurance. So just quickly here, through the support groups for Hussein, we saw here these drawings by Hussein. In the beginning of the journey, it's the right one. when he's before the surgery, express the emotions. We reach here, there is Amani, but I pick this one Hussein after the amputation. So this kind of what we're gonna through. So the gray work, attempting to understand himself and the self-image. Transformation for Hussein, he was anxious, withdrawn, dependent. Since the incident, he became confident, restoring the functionality for his life, which is impacting in general of life well-being. He expressed the joys, plans for the future. So this kind of the pain management was included since the beginning. It includes the psychological and social learning. The caretaker, it's a big part, the caretakers in the child management. So this is our hero Hussein. So healing goes beyond medicine. It's about restoring hope, dignity, and childhood for all of the patients who had been. Our hero Hussein, he's a story of trauma transferred into resilience. Thank you, everyone.